Researchers are seeing promising signs for mRNA vaccines when it comes to treating pancreatic cancer. As you know, that is one of the deadliest cancers. It does come months after HHS and the secretary there canceled $500 million in funding for mRNA vaccine contracts. Do you think in light of this new research that HHS should rethink that decision?
Well, first of all, Caitlin, I've taken care of pancreas cancer patients at Johns Hopkins for over 2 decades. I'm ecstatic to see some exciting new treatments for pancreatic cancer. We've issued a national priority voucher for another KRAS inhibitor, another class of medications separate from that of the vaccine treatments. There's a number of exciting treatments. And when it came to the mRNA vaccine research from HHS, I was very clear. We are excited about that potential technology. We just felt like it should be the companies that made $50 billion from mRNA technology during the COVID pandemic that should be funding their own research, not taxpayer dollars. Taxpayer dollars should be going for research that nobody else in the market or investor community will fund. So this research was privately funded, and as you can see, it is potentially promising. I'm looking forward to those applications coming to the FDA.
If it's a matter of these companies having enough money to fund their own research, you know, when HHS canceled those contracts, they didn't mention funding in the statement. Instead, they said that they were turning towards safer, broader vaccine platforms. They seem to be casting doubt on mRNA itself.
Well, let me give you, first of all, we've approved 2 mRNA updated shots in the first year of the Trump administration here in this term. What we are funding with the money from ARPA-H that was going to mRNA vaccines are things that otherwise would not be funded that could have profound impacts for those with deafness, blindness, cancer, areas that are in blind spots in American medicine and in research. Let me give you an example. Some of that money was diverted for a potential universal flu shot. That means that you could potentially get one shot with long-lasting, decades-long protection without having to get an annual flu shot each year. It could also enable protection against flu strains that have yet to mutate. So it is an important pandemic preparedness thing. Companies are generally not interested in funding research for a new vaccine that's going to replace their annual vaccine with the annual revenue that comes in from those vaccines. So that's an example of sort of an area of research funding in medicine's blind spot that desperately needed funding.